Graham?
I'm good. How are you?
Good. We're going to be right here today. So have a seat right there. Just going to go over your medical history. Alright. Have any special concerns or anything for today's appointment?
No.
Alright. And with your medical history, I see that you have Hashimoto's. And when were you diagnosed with that?
I want to say about 6 years ago.
And do you take medicine for that?
Syncope.
And you took that today?
I did.
All right. Is there any other issues? I see that you do some fasting.
Oh, I'm fasting. I gotta keep this waist snatched, you know? So I like to fast a lot.
Okay. And you're fasting today?
Oh, absolutely.
So what time do you think you would normally eat something?
So I usually stop eating at 8 at night and then start eating back again around 3.
Oh, wow. That's a long time.
Yeah, we get used to it. Anything to get, slow.
Okay. And then anything else? Low blood pressure I see on your medical history?
Yeah, sometimes.
Okay. All right. But you're feeling good today?
Oh, I feel great.
All right. So we're just going to take your blood pressure. Today. Is that pretty normal for you?
Oh, I don't know. I don't check my blood pressure.
All right. Well, I'm going to go get your hygienist, and she will get started with you today. Be right back. Miss Graham, this is Kenzie, and she'll be your hygienist today.
How are you doing today, Miss Graham?
I'm good.
All right.
We went over her medical history today. She does have Hashimoto's, and she takes Synthroid.
Okay.
She's taken her medicine today. She is fasting, so she hasn't had anything to eat since last night about 8.
Oh, wow.
And her blood pressure.
Something.
I get that bikini body right now.
Very nice.
And her blood pressure today was about 110/60.
Okay. So that's a little low. Do you know if that's normal for you? You don't check it on the regular? Okay, okay. How are you feeling today, though?
I feel great.
Okay. All right. Well, then we'll go ahead because you do have a history of having a little bit lower blood pressure anyways. So we'll go ahead and continue today's treatment and just check it out. Okay. Okay. So
332 311 727 567. All right, so we just finished up the last research party. So what I'm going to do is I'm going to have Dr. Zlaki come in here and do an exam, okay? She'll check over everything that we just looked over. Okay. How are you feeling right now? Okay.
hi, how are you doing today?
Hi.
I am Dr. Zalaki. It's nice to meet you.
Nice to meet you.
How are you doing? You feeling okay today?
Yeah, I'm doing good.
Good, good. How was your breakfast this morning?
Oh, brother, I didn't eat breakfast.
What? You don't eat breakfast?
I do not.
Man, I would be hungry.
Yeah, you get used to it.
Yeah. You got big plans for lunch?
Nope. I don't eat till 3.
Oh, wow.
Very strict.
Wow, very strict. Okay, well, I'm just going to take a peek, make sure everything looks okay, all right? Go ahead and open for me. And bite down for me. Good. You look great. Any questions for me at all? No. All right. Well, you have a great rest of your day. I'll see you next time.
All right, thank you, Dr. Zila.
All right, Miss Graham. So we are done for today. So I'm going to go ahead and set you up. And we'll walk you out in just a second, okay? All right, Kristen, if you wouldn't mind grabbing her goodie bag for me. Now we can take those from you.
Thank you.
Just try to get up kind of slowly if you can. Just a little slower than that if you would for me. Are you feeling okay?
I'm a little dizzy.
A little dizzy? Okay, why don't we sit down a little bit? Oh no. Kristen, go get the doctor. She's fainted. Oh no. Grab the oxygen tank. Mrs. Graham? Mrs. Graham, can you hear me? Miss Graham, we're gonna put this oxygen on you. Miss Graham? Hey, you feeling okay? You just passed out because you stood up too quickly there. When at the end of your appointment, yeah, You might have felt a little lightheaded. So what we're gonna do is have you stay laying down so you feel better, and then we'll go ahead and sit you up slowly, give you a snack, something to put some sugar in your system so you feel a little bit better, okay? Does that sound good to you? Sounds good. Okay, I'll have your hygienist come in.
How are you feeling, Mrs. Graham?
I feel okay.
Feeling okay? All right. Well, you've been laying down for a few minutes now, so I'm gonna go ahead and slowly sit you up, but I don't want you to sit all the way up, okay?
Okay.
Just easy does it. All right, and Kristen here has got your snack. So I'm gonna set you about this far and go ahead and have you take a snack, okay?
How many calories are in this?
All right, now I'm not too worried about calories. I'm more worried about getting that sugar in your blood system, okay?
Okay.
All right, do you feel better now that you got that food in your system?
I do.
Okay, perfect. I did see that your husband was your emergency contact, so we are gonna call him to come get you, okay? I don't want you driving right now by yourself.
Sounds good.
All right, and then I do advise, I know you love your fasting, but I do advise on days that you have appointments that you do have something small in your system at least, okay? That might minimize the risk of this happening again, okay?
Okay.
And so what we're gonna go ahead and do is I'm gonna go ahead and slowly swing you around. You're gonna sit up very slowly, okay?
Okay.
All right, let's go ahead and spin your feet around. All right, how you feel? Go ahead and stay seated. You feel good? Okay, I'm just gonna have you stay in this position and until your husband comes. Do you have any questions? No? Okay.
As we conclude our syncope video, the signs and symptoms are pallor, pupil dilation, diaphoresis, weakness, vertigo, nausea, yawning, elevated blood pressure, slow pulse, shortness of breath, chest pain, and loss of consciousness. These are important to watch out for in your patients. To treat syncope, you need to look at the level of consciousness of your patient, put the patient in supine position with feet elevated, only perform CPR if the patient is not breathing. For your treatment steps, you will first loosen clothing, then you will administer oxygen 4 to 6 liters, then you will monitor vital signs. Next, you will slowly return the patient to a seated position after they gain consciousness. Call the EMS if the patient does not regain consciousness. Thank you so much for watching.